So good morning. I'm Holly Turner, Director of Advocacy Services, and we're going to talk today about the Adult IDD system for services. If you have any questions, if you're watching this as a recording, here comes someone. If you are watching this as part of a recording and you have questions, please contact CPARC's Advocacy Department and we'll be glad to answer those questions. And note too, if this recording is more than a year old, things may have changed because things change constantly in the adult system and how it works. So you should be able to see my screen. And again, I will be sending this out to everyone who attends. Navigating the Adult IDD system. It sounds like we're sailing a ship and I wish it was smooth sailing. I am the doom and gloom master. I feel like every time I talk to parents, it's depressing. I will try not to be that negative. CPARC's mission is to empower, inspire, and educate individuals with developmental disabilities, their families, and the community. And we want them to live and work, play, and thrive in their community. I always like to point out that the handsome guy in the picture up to on the right with the hat on is my son. So. We are going to talk about adult services. That's everything. This is only a small portion of it, from day programs to habilitation, transportation, employment service. When I say residential, that may mean a community group home, but it may also mean someone in their own apartment with staffing coming in, for as many hours a week as they need. It could be companion services or behavior services, and many more. We're going to talk about eligibility for services, how funding system works and what are waivers, how do you apply for services, what happens after you apply, and important information to think about as your child gets ready to graduate, and the current crisis, and it is a crisis in adult services. Receiving services comes down to three key components. One, are you eligible? That's the first hurdle. Two, what are your needs? Because services will be based on needs, not what you want, but on what someone needs. And funding, because you can be eligible and have needs, but if there's no funding, oh well, that is it's not like that. In the school services, if it's in your IEP and it's determined you need it, it must be done by the school, but that is not true in adult services. Now I say three, but there's a fourth one right now that has always been a problem, but it's come to a real issue, and that's staffing. You may even have funding and have the waiver you need for services, but the provider of those services may not be able to find enough staffing to provide the services. In order to receive the adult support services that we're going to talk about today, you have to either have a diagnosis of intellectual disability or autism, or both. In order to be eligible for services, you need to have the diagnosis of intellectual disability or autism, have adaptive skill deficits in 3 or more areas, and we'll talk about that later. The disability must have occurred prior to 22. And eventually, and this is something that you would get through the process, the individual must be recommended for an institutional level of care by a physician using a form called the MA51, which would be given to you for your doctor to sign. Doctors just sign this. I've never heard of them saying no. And really what it's saying is, it's a harsh thing to hear, is that back in the day, your child would have been eligible to go to an institution. But instead of that, we're going to waive that and provide care in the community. So it's really a harsh form. The intellectual disability is defined by limitations in intellectual functioning and adaptive behavior, which is everyday social and practical skills. And again, the definition, this is the technical definition, says it has to originate before age 18, but the county uses age 22, which can be impactful for someone in an accident at 19. IQ is below 70 is an intellectual disability. The county sticks by that very, very severely. So if someone has an IQ of 71, they will fight not to provide services. And frankly, what's the difference between someone with an IQ of 69 and someone of 71? But I will tell you, if your child has been tested and their IQ is 68, do not have them tested again. We don't want the chance of it going up enough points that this is a problem. You must have limitations in adaptive behavior, and these are the areas: self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living. And this is true for autism or ID. And schools typically use, and the county accepts, the Vineland Adaptive Behavior Scale. I think there's also the ABAS that they might use. If your child has not had this test before graduation, I would push for it, but they most likely have, or a similar one. And you only need to have deficits in 3 or more areas. The impairment must occur before 22. If someone is in an auto accident after that, it's a traumatic brain injury, and it's not an intellectual disability, and you would not qualify for these services. Now, I knew a young man at the high school I taught at, a football player that was in an accident, and he became severely cognitively impaired, and it was before 22. His parent had the choice of either an intellectual disability funding or traumatic brain injury, and she went with the other. In the end, it was fine, but because he didn't live to see 30. But honestly, more services are provided in the ID waiver. For autism, it's very similar. You must have a diagnosis of autism. You must have adaptive functioning limitations on the same tests in 3 or more areas. So that's the same. So now we get to funding. Where does the money come from for adult services? Well, it is funding that are called waivers, because we are waiving, unless you private pay. If you're rich, you can private pay. From the fact that we waive medical assistance that would have paid for institutional care to provide supports in the community, which is why it's called HCBS, Home and Community-Based Services. But it is Medicaid money. It is possible, I say it all the time, to be eligible for funding and need funding and not receive funding. Services are not an entitlement. I think they should be, just like school services, but they're not. In Pennsylvania, the Department of Human Services administers lots of different types of waivers. They have them for people who are elderly, because we want to keep people who are aging in their homes, for people who have traumatic brain injuries, for people with just physical disabilities. And the new one is the Infant, Toddlers, and Families Waiver. The ones we were going to talk about are the ones in red and blue. The red ones are for intellectual disabilities. The blue is autism. Providers of services do not accept all waivers. Most providers of intellectual disability waivers do not accept the autism waiver. If your child has autism, you may qualify for the ID waiver. So, and the reason is, this makes no sense. The reimbursement rate to providers bill the state for their services, and it's based on set rates. There's no control by the provider over what those rates are. They're set. They're lower for the autism waiver. And that makes no sense to me, because the number of staff that might be there could be even higher. So I really don't understand that. So for instance, C-Parks day programs, I'm pretty sure don't accept the autism waiver. I know CIT does not. I know the group homes absolutely do not accept the autism waiver. And that is true for a lot of behavior support programs. There are providers that specialize and use the autism waiver. I've only had 2 people on my caseload that were in that system, and I don't know it as well. It's managed by totally a different agency than the county MHID office. So you also need to be financially eligible. The adult child does. That's not based on your income, but only on their income. So once they turn 18, they're going to look at them. And again, waivers are usually only given when someone reaches the age of 21, which is why you're encouraged to stay in school. And you can only have one waiver at a time. Once eligibility is established, they will look at financial eligibility, and it's looked at every year. Many people have jobs and are still eligible for services. So don't believe that if an individual works, they can't have a waiver. Many people work and have waivers. The other thing to consider because of financial issues is inheritance. If you pass away, what does your will say? Is your child going to inherit money? Because there's a limit for how much they can have depending on the type of, usually it's 2,000 if it's SSI. If it's SSDI, I believe it's 8,000. That's all they're allowed to have. You can set up a special needs trust, which is not counted as resources. You can also set up an ABLE account, and you can put might be 15 now, $15,000 a year into that account up to 100,000, not counted as resources. So it's hard to think about, but if we pass away, we don't want to blow the entire program that we set up for our child. We often, if you're, please let us know if you're interested. We often, it's been about 2 years since we did a special needs trust and ABLE account seminar. So we'll set one up again soon. We bring in attorneys to do that. We don't do that. There are 3 types of Medicaid IDD waivers: the person and family directed support waiver, the community living waiver, and the consolidated waiver. Excuse me. The PFDS is the nickname for the person and family directed support waiver, has a funding cap of $3,000 per person per year, which means that's what you can spend. They will add $15,000 for employment because we're very big on people working. So if your adult child would need job coaching and they've already gotten close to that, the county might throw in another $15,000. But it is limited to that. So you must think about looking at all the services that you could get on that waiver. The units have to add up to no more than $33,000 a year. So if you use respite, how much of it do you need? If you use transportation, what are those costs? If your child is in a day program 5 days a week and needs behavior support and needs transportation, and this happened once, that's why I know this, and then you add, oh, they want to go out for community participation support at their day program in addition, it can be too much for this waiver. So then you'd say, well, maybe they go 4 days a week or 3 days a week. The second waiver is the community living waiver, which is $70,000 per person per year. They don't count your supports coordination in that because that just comes with it. It has many of the very same choices, but it's limited to 100,000. The consolidated waiver is the golden ticket. It has no cap. It's the only waiver that would cover residential habilitation. Someone with complex medical or behavior needs was probably going to need this waiver, whether they live in residential services or not, because it's going to go over 70,000. This waiver used to be the only one that existed. And my son is old enough that he walked out of high school with this. And I count my blessings every day because I didn't have to fight for this. It's just not like that anymore. Our county is very good at managing waivers. They know what they're going to have. And if they know someone's leaving school, I have never seen someone, especially in the last couple of years, as tight of it as it's been, they've had at least the PFDS waiver to start with. All the services are very similar, except you can see residential habilitation. It's called licensed and unlicensed. There's different types. A community group home for someone with minimal behavior is probably about $140,000 a year. For the autism waivers, you may qualify. You can apply if your child is autism for all of these waivers. They didn't add more money into the IDD budget, but they said people with autism could apply for those waivers too. So that was nice. But it makes sense because a lot of people with autism need the same services. So you can apply for the ACAP, the autism waiver, and the ID waivers all at the same time. The ACAP is only available in Chester, Lancaster, Cumberland, and Dauphin. So if you're from Perry, you're out. And I don't even know how much longer it'll last, but there's no cap. It is a managed care system. So everything, physical health services and community services, are all paid together, and you must be within their program. So if you look on the left side of the screen, those are all more medically based services, and all of those are covered by the ACAP waiver. So all the medical insurance, hospice included, you know, is on there. And on the right side are all the community-based services that you might need. The people I'm aware of on ACAP are individuals who are fairly independent, who might be in their own apartments with staffing. I only know a few because I have friends whose sons are on this waiver. The adult autism waiver is across Pennsylvania, and again, you need the same eligibility requirements. And there are what it covers. So how does funding work? Well, the federal government, through the Center for Medicaid and Medicare and Medicaid Services, CMS, they give so much money to the state. Here's your Medicaid dollars for this service. And CMS is the boss of our state organization, which is ODP, Office of Developmental Programs. So they give the money to the state. The state puts money in too. It's both, it's state and federal dollars. And then the state gives money through waivers to all the counties. So they decide how many waivers and what type every county gets. It has historically, when we're just talking about consolidated waivers, not been divvied up fairly. You would think it would be based on population of all the counties, and it is not. We have been fighting, Cumberland, Perry, MHIDD, CPARC, and Coldridge, our executive director, has been leading the fight in the last couple of years to find out about this and fix it. All the local representatives, because central Pennsylvania is at the bottom, all the counties in central Pennsylvania, except Dauphin, are at the bottom. And so all the representatives were up in arms when we educated them about this, and they've been pushing and trying to get it changed. Right now, it's not even the main focus of our fight, but we don't know why. Cumberland is like at the bottom, and we're one of the fastest growing counties. So Clarion, live in Clarion. Theirs is like, it's not that they have the most per capita though. But we're working on it. So they give the waivers to the counties, but all the counties have to get waivers. And so there's a limit. There is a limit to how much money's in the pot. And that's understandable. The counties then decide who gets the waivers. It's up to the county. And again, if they know you're graduating, our county is very good. Cumberland Perry is very good at deciding and getting a waiver to graduates. We have heard from other ARCs that they have had graduates not have waivers. We've not experienced that. For Cumberland and Perry, you would go through MHIDD, mental health, intellectual and developmental disabilities. For Dauphin, it is CMU. Counties are all a little different. I think York is MHIDD. There's one that's like Juniata. They have like 3 different organizations. It's very confusing to me how that works. But I only need to know Cumberland Perry, and it is MHIDD. I really work well with them. I think our county agency tries very hard to manage this on a tight budget. So how do you get services? Your first step is to reach out to MHIDD or CMU if you're in Dauphin and tell them and ask for intake and start the intake process. If you're already connected to the county, which is great because you can do this at any age, you're ahead of the game. They're responsible for allocating funding and then coordinating supports within the home community and connecting the individual to providers. The adult autism waiver is managed by the state, but not the county. I say at this point in time because one of our county entity people told me that they suspect they'll manage all of them eventually. And they will help you connect for the autism waiver if you ask. Autism waivers are given on a first come, first served basis, not by need. And you can sign up to get on the list at 18, but you won't get a waiver till you're 21. And I know adults with autism that graduated at 18 because they were in regular classes and they've called us for help. And it's like, you can't get any until you're 21. You can call this 800 number, 866 number, and you can go on DHS's website. If you search for Pennsylvania waivers or Pennsylvania autism waiver or Pennsylvania IDD waiver, you will get to their page. And I think in the last 2 years, they've really changed it. It is very clear. I want to explain all of this to you and give you and hook you up with what you need. So I suggest if you want to do some research, you can do that too. Again, you can register with both MHIDD and with the Bureau of Supports for Autism and Special Populations, which is how you register, but you can only have one waiver at a time. So if you think you meet eligibility criteria, what do? Well, collect your paperwork. What do you have that proves diagnosis and adaptive functioning? Evaluations and IEPs should do it. If you have an evaluation with the diagnosis and with the testing information, you're gold. That's good. And you can ask your school too. Contact MHIDD and ask for intake. They'll ask you to send your proof of eligibility. They'll ask for that information, and then they will send you the MA51 form and walk you through the rest of it. It is your responsibility to do this. They are not going to track you back down. The school's not going to do it for you. It is up to the parent to get this done. MHIDD has one intake person. CMU has more. So the one intake person is pretty overwhelmed. So calling to get an appointment without sending paperwork is not going to work. People have done that. Just showing up at their office is not going to work. Most of them are working from home, so it really doesn't make it work now. Calling us and asking, I've had a parent go, well, I called you because I thought, then they'll do it faster. Nope, not going to happen. But if they haven't responded to you, if you have sent things, then call us, because they always respond to my emails. And if you have their email contact, and you will get it eventually once you start the process, that works better than phone. People often leave very poor phone messages, or they don't get through for reasons. So email is always best, and then you have proof that you made the contact. If you are eligible, you will be assigned a supports coordinator who is your case manager. They will manage that case. If you don't like your sports coordinator, you can easily ask for another one, and no hard feelings. I mean, I have seen it done. There are no hard feelings. So maybe it's a personality. Maybe you don't think they're fighting hard enough. Although if you ask me and tell me what's going on, sometimes I'll tell you they're doing the best they can. It just seems like things aren't moving. But they will help guide you to choosing supports and services. They will focus on what the individual needs to live as independently as possible. And assessments will be done. Oh yes, the adult world has as many or more assessments than school. First, you'll go through and complete a PUNS, prioritization of urgency of need of services, then a supports intensity scale, the SIS, and then an ISP, an individual service plan. Being eligible for services, how many times I say it now, does not mean you're guaranteed. It's not an entitlement. So you could go through all this process and still not get services yet. Your supports coordinator will help fill out a PUNS. This decides what are your needs and when do you think you'll need it and how urgent is the need. All the counties do this, and it doesn't mean you're going to get services, but it's really helpful because they'll decide, are you emergency need, critical need, or planning need? Right now, if you're in school, you might be planning need. Although if you're just about ready to leave, you might be more at critical need. A lot of people in the county are at emergency need. But that lets them know where you are. And yeah, if you're fighting for something with other people, if there's a competition, if you're in planning, it's the emergency people going to get it. But regardless of whether you get a waiver, we need a PUNS because it lets us know what you are thinking. And think about ahead. Where are you in the next 5 years? I would think further than that. A lot of parents will say, there is no way I want my child to live anywhere else with but me. And that's great because they support that. That is kind of what the state wants. It's cheaper, but it's also their family and community. But you don't know where you're going to be 20 years from now. Parents don't live forever. So think ahead and let them know that, well, I don't know when, but someday my child might need supported living, either in an apartment of their own or a community home, or whatever you think the possibility might be. Another reason to complete the PUNs is it helps the state plan for what's coming up, what they're going to need in the future, create their annual budgets. It helps them know we have the wait list and gaps in services, and it helps advocacy. Like if we have the PUNs numbers, which we do, and I'll show you later, we know how it gives us information to fight with. So the SIS, the supports intensity scale, if you've been through this, oh, this is fun. The SIS is done by an outside agency, and it's an ODP requirement. It's done now every 5 years. It used to be every 3. You can ask to have it redone. If there is a sudden change in someone's needs and their behavior or their ability, we have a lot of people getting older. Thank goodness people are living much, much longer, but we're dealing now with aging issues. And so we'll ask for a new SIS. But it evaluates the frequency, intensity, and type of need for supports. And it's tied to funding. So if your child, your adult child has high need, like they need intensive support and they need it frequently, they're going to get a higher number, which means the provider of the service can bill at a higher rate. Maybe your child needs, they need, when they go out in the community, they need to have someone with them at all times. Or maybe when they're out in the community, if there's a group of 3, they need at least, maybe they need one-on-one. It doesn't happen often, but they might. So that would give the provider the ability to bill, to be able to hire staff to do that. It is a really odd process. The SIS assessors are fairly nice people, but it takes about 2 hours, sometimes 3, depending on how much the team will talk, because they want a team there. The ones I've been on, it's been odd. We had a man who was elderly, who was retired, and we still had to go through the employment questions. An example of one would be, how much support would your child need to go to the library? So maybe your child can do that totally independently. Maybe your child needs transportation. Maybe your child needs totally complete hand-over-hand support. So then you get that decided. Well, how long would it take to do that? That's another question. So you'll think about, how long does it take to go to the library? How often would they need that? Well, I don't know. How often does the average person go to the library? I mean, that's just one question. That's why it takes 2 to 3 hours. And it used to not matter. This was just something they did and no one paid attention to it. I didn't even go to my son's SIS assessments. And then about 4 years ago, maybe 5, time flies, we heard it was going to be tied to funding, and it is. And so now it is very important. Lay it out there. Be very truthful about your child's ability. Do not make them sound like, oh, they can do all this independently. If they need help, make it very clear. I have seen teams argue with a SIS assessor because the entire team went, no, they need this. We've seen it. It's really important to get this right. The ISP looks nothing like an IEP. It is written annually, and you can ask for updates at any time. We often have monthly treatment team meetings for people, especially if they live in community homes. And we'll often we'll make a change, and the ISP needs updated right there. If it's in the ISP, then the provider has to do it. That is something that's similar to IEPs. And there are goals and outcomes. Like my son is working on a cooking goal, which he loves. There's what kind of support do they need in the community? There's something that says that it makes sense. What makes sense for that person? What doesn't make sense? And sometimes things have to be written, like it makes sense that Bobby live in the community residential home, or it makes sense that Bobby a 10-day program. They have to write that in there. Tori is with us. Tori is my newly hired, well, she hasn't started yet. She is a CPARC employee currently, but she will be moving to my department, yay. And she has seen ISPs because she works in adult services. Do you have anything to add about them, Tori?
Yes, the ISPs do cover a lot of different areas of living. They cover all areas of living. So you think meals and eating, dressing themselves, it does cover all of that instead of just like educational plans like an IEP would. So they do look completely different. And there's even staffing ratios in there, which would be how many staff are needed while the individual is in the program versus out in the community and things like that. So it does look quite different.
And it's very repetitious. Like they have tried to, ODP has made changes, but it seems to make things be repeated even more. Something will be written 3 different places. And if the supports coordinator doesn't make the change, this happened recently in a program, someone's diet or feeding was changed and they didn't change it in one spot. Well, that could get the provider in trouble. So it's always a lot about the paperwork, isn't it? All right, if you cannot get services, and again, if your county knows you're coming, most likely you will get funding. You will be put on the wait list. And right now in Pennsylvania, there are over 12,000 people as of August 31st. 12,000 people without funding, not waiting for a provider, but without funding at all. And in our counties alone, in Cumberland, Perry, there were 271, 112 on the emergency list. So that just is sad. And those are the people we know about, because I get calls all the time. Hi, I'm calling about my brother. He's 43. My parents passed away and he's now living with me. We need help. And they've never been connected to the county because they live with family and family has been with them. That happens, I can't tell you how many times a year. And so those people then get added to the list. And they may bump ahead of you. So if you are waiting for a consolidated waiver and someone comes up that is an emergency situation and needs a place to live, they're going to bump ahead and get that. The autism wait list, this was, and I forget the date, this is older, but there were 2,800 people waiting. And this is the projection from ODP. Well, yeah, we know people with autism have been identified and we see that growing. So of course, services are going to need to be increasing. How long will people wait? Well, it depends on available funding in your county and your urgency of need. It's not like a bakery or deli line where, okay, next. The county matches resources with people based on need, and people in emergency will have priority. But I have people on emergency. I have someone, a young woman in a nursing home waiting for services. She's no other place to go. She had some physical issues and was hospitalized, and then she was moved, and we were in court. A judge agreed with this decision. And she's been there for months and months and months. I have someone who's been in respite for a year, respite, who I think is moving at the end of this month into a group home. But so even emergency, there are people who are dropped off and abandoned in hotels. I know those people. There are people who come out of prison. They were in there because they didn't get the supports they needed to begin with. That's why they got in trouble. They need help. So, and people in life-threatening situations will jump ahead of everybody else. It happens. So what can you do while you wait? Well, look for employment on your own. I know that's like you have time for that, but I helped my own 16-year-old fill out applications and talked him through it. If you can do that, if your adult child could volunteer, if you can get any of that set up on your own, that helps. Everything helps. Open an ABLE account, talk to an attorney about a special needs trust, get all of that set up. And then look for the natural supports in your community. I used to hate that word when ODP said it because it means unpaid. And they act like there's always, I saw Tyler. They always say, like that just makes me upset because they want it to totally replace paid services. But we know, I know as a mom, other people either can't or won't help sometimes. So that's hard. But there are some things out there. Get your child involved wherever you can. Volunteering, Club Cafe is that's a church, a vibrant church in Mechanicsburg. I used to go there, and we started this club. It's a monthly social club. I mean, up to 100 people sometimes go. I know that they've continued that, and I have that contact information if you want it. Sea Park used to have dances 6 times a year, but with COVID, we shut it down. I don't know if we're going to start it again. We will see. But there are activities out there, and those are important. We also have seminars for adults with disabilities. We just had a first aid training. A woman who is a parent and a certified CPR trainer Zoomed with us from Massachusetts while we met in person and taught some first aid for some folks. We have a seminar coming up November 10th. A giant nutritionist will be Zooming how to, a pizza recipe. She's going to talk about nutrition and my plate, but then you will have the recipe and you can sit and the individual can cook with her. We have healthy relationships, a class about that very thing. It talks about taking care of your body, basic sex, genitalia information, and then most of the classes on relationships, because we are trying to prevent people from being abused or being abusers. Both things happen when you don't understand. But many other things. We have some music. We have a music therapy lesson coming up. It's a whole series called Healthy Choices that goes with the healthy cooking, music therapy, and then an exercise. So look for those things. It's really a good thing. They're free. Encourage the highest level of independence you can. Adult services are different than school services. This is the real world. Just because you have a one-on-one in school doesn't mean you're going to get one in adult services. And I know how special ed works because I was a teacher and a parent, and I know sometimes the loudest voice gets what they want because the school just wants you to be quiet. It really does happen. Doesn't happen in adult services. Not going to work at all. If your child needs a one-on-one, you may get one, but it is really need. I have seen many individuals transition to adult services and need much less staffing. I think that the demands on someone in an adult like day program, Tori works in one, it's a really excellent one, are very different than demands placed on an adult in school. And so I think behaviors are less sometimes. I just really do. Continue to improve your life skills in all areas, anything at all you can work on, from dressing to eating, whatever it is. Stretch your child's ability to be independent. Temple Grandin has that quote, I think sometimes parents and teachers fail to stretch kids. My mother had a very good sense of how to stretch me just slightly outside my comfort zone. We don't want to exasperate our children, but we do need to stretch them as much as possible. And realize that laws do not make exceptions for people with disabilities. There are many people in jail, I've met many of them, with IDD and autism. Work on boundaries and social skills. The legal system sees people with disabilities as all mental health. Oh, they have mental health issues. I see it over and over again. So often when I've met with public defenders, I have explained what the disability is, and that has helped them a lot. And often we try to avoid jail as much as possible, but not always. And a lot of times people are in jail because they didn't. A man I know lives on his own. He went to jail for exposing himself, and he's been great. But it was because he wanted a relationship and he had no idea how to do that. And I know that sounds odd, but it's the truth. So information helps people with disabilities. They need to understand how relationships work as much as possible. How can schools help? Well, sometimes schools take this training, by the way. We've had several school districts go through this. We encourage parents to open a case with MHIDD as soon as you can. We encourage schools to provide those diagnoses and IQ results, especially the adaptive functioning tests, either the Vineland or the ABAS. And we encourage them to help with future planning and independence. Because the reality is the bus does stop coming, and there may not be another one. Services may be needed, but funding may not be available. So now the doom and gloom is there. If you're not happy, we really need help advocating. There is a local MHIDD task force. It's a parent-led group that's organized, and they've been fighting. They have not met this entire year. And I asked the one dad in charge, when are we going to meet again? COVID's really impacted that, but that's ending. We're going to get there. But that's a good group to stay in touch with. And they meet in the MHIDD office. Contact your local representatives and the governor and tell them your story. Your stories are so impactful. We meet with the representatives all the time. They know us by name, but when they meet with you, you're their constituents, and they need to know you live in their districts and what you're facing and what your adult child needs. Explain why you need it, what your life would be like without it or with it. Get on our email list if you're not, for alerts and advocacy opportunities, as well as opportunities for your adult child. There really is power in numbers. So I'm going to go into the current crisis right now, because it's beyond that. For years, services have been underfunded in adult services, and direct support professionals, DSPs, are the people that provide direct support to people in adult services. They have been underpaid because providers can only pay DSPs based on the reimbursement rates from the state. The average wage of a DSP in Pennsylvania is $13.20. So half are making less and half are making more, but the average is $13.20. You can go push carts at Walmart and make $16 an hour. That's it. My son did that, so I know that's what you get paid. It's ridiculous. These people provide medication management, encourage relationship skills, provide personal care, incredible personal care, and many more. Tori could go through. Tori, what are some of the things that you're a DSP right now?
Yeah, so we also do, we follow behavior support plans and support individuals in behavior support. We help with communication support plans and teach them how to use alternative communication, things like that. As Holly said, medication management, personal care, meals and feeding. We cook, we clean, we do all sorts of things for our individuals, happily, but we still, we do them.
Yeah, and happily, because Tori took her a long time to decide that she wanted to leave to come to my department. So I actually was with a DSP. If you didn't see, we were on Facebook. It was on the news shortly. A DSP who is expecting her third child said to me, I think I'm going to take my full maternity leave because I'm afraid I need to be with my ladies. She works in a community home. Of course she has to take her leave, but that is the level of dedication. But this has always been a crisis, and the pandemic hit, and now it's beyond that, but it has been a problem long before that. Right now, turnover rate is approaching 60% and vacancies are 30%. People with disabilities are unable to get services or in emergency situations waiting because we can't get staffing. We can't raise wages to compete with Walmart and Amazon and all the warehouses. We need significant funding right now. We've asked the legislative body for years. In fact, we met in the spring via Zoom. We brought in families, we brought in self-advocates, and they all looked at us and said, we know what you do is important. We know that these people are important. We know there's waste in government, and man, we want to take that out, but this is not wasteful. And then they did not vote to increase funding. We've asked the Office of Developmental Programs to look at their reimbursement rate. They have not even given a cost of living adjustment every year. So as my boss, Ann Coldridge, likes to say, she goes, I'm not Nike. If the cost of leather goes up, Nike increases what they charge for their sneakers. We can't do that. And yet the cost of gas for all the transportation that they provide, the cost of health benefits for the employees, everything has gone up, but the rates have not gone up. So imagine trying to keep that working. We have lost staff, and CPARC itself, and we are not alone, has consolidated 2 group homes. We have 28 group homes, 2 of them. Now, sadly, we lost some individuals over COVID, and just because of aging, we have a fairly older population in our homes. And so there were openings. And so we didn't kick anybody out, but we moved people that have lived in their homes for years because we didn't have staffing. And so 2 homes were moved, ladies moved to another home, and now the staff, we have enough staffing in those homes, but we don't know how much, what other homes may that happen to, and it will happen in other providers. It has happened. It is a collapse of the adult system, and I don't like to be so scary, but it's the truth. It's where we are. I have said, my son lives in a CPARC home. He was with CPARC long before I was, and I said, if you need him to come home, I have a room. And they're like, no, we're not there yet, but I know that that's a possibility someday if this doesn't get fixed. So we are currently asking for some of the rainy day funds. Instead of giving money to the system, they put money away. We're asking for $540 million from the American Rescue dollars that are right there. We're asking for that immediately so that we can just give something to our staff right now to retain them. And then we need more investment. They need to put more money in on a regular basis, as well as the Better Jobs, Better Care Act federally. There is a line in there for Medicare, for home and community-based services. So when you hear that, and you may or may not be for that whole bill, that part of the bill is, when it says elderly, it's also disabled. When they're talking about investing in Medicaid, that's adult services. And originally they were going to put, I think it was 400 billion in, which would have solved this problem. We really felt that would have solved it, and that people could have, if you needed the service, you would get it. It would have been an entitlement. But it's now down to 190 billion, which sounds like this huge amount of money, but that's for all of the United States. So we're asking you to help advocate for this, because we need parents in mass numbers to push for this. You can contact your legislator and explain this. You can go to Find Your Legislator, and I'm actually going to send an email with all of this on specifically, and tell them what you want. But you can, if you don't know who your legislator is, there's a website that will help you. You can go to the ARC of the United States. You can just click right on this, and it'll go automatically to your senator. But please put your own story in there. There's a little part where it just says what's going on, but your story is vital. It's vital. And I think calling your legislator, making an actual phone call, their staff will answer and they'll take it down, but it's one more call. And you can contact them several times. It doesn't have to be once. There is a rally on October 25th at 11 a.m. outside on the steps of the Capitol to shed light on this and ask for the American Rescue Plan dollars. If you could be there, that's great. But if you can't, use that day to contact your local legislators. That's a good day. And tell them, hey, this rally's going on. Do you know about it? Get the questions there. But again, I don't want to be totally scary, but that is where we are. And I'm really proud of the fact, although I had nothing to do with it, that it was the ARC of Pennsylvania who sued the Commonwealth of Pennsylvania. And that's why we have special education services. Pennsylvania started that. Pennsylvania parents, that's what ARC is. It was started by parents. And families fought for the right to education. And look what we got. Well, we need to fight now. This is the big battle. And honestly, CPARC is yelling as loud as we can. Again, look at our Facebook page and you'll see what Ann Coldridge said and what a parent said, what a self-advocate said, what I said. I feel like we're fighting alone. We really need you, and we need you to tell other families, this is the time, this is vital, because these services may not be there. And tell all the families you know that children still in school, because they're fighting for the future. It's not just for adults who are here now. So now that I said all that doom and gloom, does anyone have any questions?